Hi, my name is Catherine Bowen, and this is my project on polycystic kidney disease for pathology and immunology. So first, what is polycystic kidney disease? It is called PKD for short, and it is an inherited disease that's characterized by non-cancerous pus-filled cyst on both kidneys. It's the fourth leading cause of kidney failure in the USA, with around 600,000 people having the disease. There are two different types. The first is autosomal recessive, which is when babies are born with the cyst on their kidneys or they develop shortly after birth. And if both parents have the gene, then the baby has about a 25% chance of inheriting PKD. It's really uncommon and the prognosis is really poor. Most don't live out of adolescence. And so the second type is autosomal dominant, and the signs and symptoms usually appear around ages 30 to 40. It's the most common, with about 90% of all cases being autosomal dominant. And then, even within the same family, the onset of symptoms can occur at different ages. So maybe one sibling is 30 and the other is 45. So, what are the cysts? Again, they're just pus filled, non cancerous. They prevent the kidneys from doing their job because they compress the nephrons and all the tubules, and this kidneys simply can't filter waste from the blood because of the compression. So, how do we test for PKD? You can have an ultrasound, an MRI, a CT scan, or a PET scan. And also, you could have genetic testing done if you think that you may be at risk. On the right here, we see two images of CT scans where both patients have cysts in nearly all of the renal tissue, and they're likely on dialysis and maybe awaiting a transplant. Complications that occur from PKD are UTIs, hypertension, headaches, pain, fatigue, and large kidneys that can become up to 20 times their regular size, abdominal girth, and hematuria, which is blood in the urine. Worsening complications occur as the disease progresses, including brain aneurysms and hepatic cyst. So the cyst can actually move from the kidneys to the liver. Size and progression of PKD are inversely proportional to the GFR. So this means as you age and as PKD progresses, your kidney function will go down. By age 60, around 50% of all patients with PKD have kidney failure, and that number increases to 60% by age 70. So how do you treat PKD? Currently, there's no cure for it, but tolvaptan was FDA approved in 2018 to treat it. It works by blocking the thirst hormone to hopefully suppress fluid buildup inside the cyst. You can also maintain a healthy diet and appropriate exercise, like reducing your salt intake and taking medications for hypertension, and then antibiotics for UTIs. Further treatment when you enter renal failure would be dialysis, which is where blood is taken from your arm and it goes through a machine that will filter your blood to bypass the kidneys. Most people on dialysis are awaiting a transplant, and once people get a transplant, they have about a 95% success rate within the first year. And of course, factors such as age and lifestyle do affect those rates. The end.